right into it and point the cone at us.
Just have to go like that.
Yeah, point that at them.
Yay!
The Bernie Sanders campaign put out his plan, his outline plan for single-payer health care for the entire nation. Wow, what a thrill. Bernie Sanders' support for this program has been steadfast for years and years, unlike some others who have endorsed it in the past. In Oregon, we are one of several states working for single-payer health care at the state level. We think if we can get single-payer health insurance created in a couple of states, we have a basis for showing why we need it and can do it nationwide. This is exactly the same strategy that our foremothers used to win the vote. Win it first in some good states, then push for a nationwide movement. Single-payer health care is fairer, it's simpler, and contrary to some people's opinions, it's cheaper than what we've got now.
Yeah.
It is fairer. A great principle of our movement is everybody in, nobody out. Everybody could go to the doctor or healthcare provider of their choice, walk in, have their needs met, and walk out without paying a bill. This is what happens in Canada. It can happen here. Nobody out. I hope you're aware that there are still a large number of people in this country who do not have health care insurance, who cannot afford
19 million.
18 million. There are still people undergoing bankruptcy because they have health care bills that they cannot pay, including some people who work for nonprofit health care providers. The insurance that they get doesn't cover their own expenses in the same hospital where they work. Healthcare is a human right. It is not something that should be denied to a person because they don't have enough money. It is not something that poor people should have to say, well, I've got to wait, or I have to take this less effective care because I don't have the money. Single-payer health insurance, everybody in, nobody out, means you get what you need. Everybody gets what you need. It's simpler. It's cheaper. No copays. No deductibles. No premiums. Just like Canada. Or Medicare for all. It's simpler for doctors. They don't have to hire staff to learn how to fill out hundreds of forms for different insurance companies. We don't have to have all these zillions of websites, all these different ways that corporate America wants to pay for health care. It's simpler for hospitals for the same reason, and it's better for business, especially small business. My heart goes out, as I'm sure yours does too, to the small business owner who has to think, can I afford to pay for health care for my small number of employees this year, or do I have to cut them back? The business owner will no longer have to make that decision. An employee will no longer have to say, I choose to work here instead of there because I need the benefits. Health care for all is a human right. Nice. And it's cheaper. It's cheaper. You don't
have to pay CEO bonuses every year.
Well, that's exactly.
You don't have to pay record profits.
That's exactly the point.
Right.
Part of the reason it's cheaper is because there are a couple people who are going to lose their jobs. The top executives of the insurance companies in the United States will lose their jobs. They'll have to go find somewhere else to make multi-millions of dollars. And frankly, some employees whose job is to figure out why you shouldn't get paid for your health care problems, they're going to lose their jobs too. So the people who process claims, they're not going to lose their jobs. Healthcare providers, they're not going to lose their jobs. It's cheaper because nobody's going to pay premiums, nobody's going to pay deductibles.
We'll be able to negotiate with pharmaceutical
and
companies.
We will be able to negotiate with pharmaceutical companies. That's absolutely right. Moreover, we will build on the system of CCOs, coordinated care organizations in Oregon, which is helping to reduce costs by changing us away from the system of pay for services. Taxes will go up. Graduated, progressive taxes will go up. Some people are probably actually going to pay more for health care under single payer than they do now. If they're very, very wealthy, they will probably pay more. But overall, the total bill is going to be less. And if you think Oregon is a pretty good state and are worried sometimes about the financial crisis affecting our state government, the state will have to pay less for health care because we will take out the fat, we will take out the profit, and we will negotiate. It's fairer, it's simpler, it's cheaper. And it's here. Here's Joe from the Rogue Valley chapter.
Yay.
Thank you, Sandra. As usual, a tough act to follow. I'm going to be very brief. I want you to know that there are people, many of whom are standing around here today, who are in our local chapter of Healthcare for All Oregon. They've been working for several years to make healthcare for all in Oregon a reality. And we're an active chapter. We have a statewide organization. If you've always wondered what to tell people about single payer or how to fire people up about single payer, we have the resources that you need in order to do that. We have films, we have videos, we have handouts, fact sheets, and I've got a clipboard here if you're interested in getting on our contact list or if you're interested in any of our information. I have a t-shirt on with the website on the front of it here. Please get in touch with us at Healthcare for All Oregon. We're going to be here at least, well, let's say for many years to come, making healthcare for all in Oregon a reality. And just as a last comment, Bernie's on board. Everybody should be. Thank you very much.
Yeah.